Right now, OHSU in Portland is Oregon's only public medical school. It's a big teaching medical center, but 2025's graduating MD class was just 126 doctors. More are needed, especially primary care physicians. Now a plan to create a new medical school to train doctors in rural Oregon, where access to health care is worse. The campus for it is in Klamath Falls. Oregon Institute of Technology has a long history of training other medical professionals, from dental hygienists to doctors of physical therapy.
So we have the science base. We're obviously in rural Oregon, and research says that providers who train and complete their education in rural settings are 5 times more likely to stay once they establish practices.
OIT's Galen Maurer says that's important because in places like Klamath County, the provider-to-patient ratio for primary care is 2,000 to 1, compared to the statewide average of about 1,200 to 1. 2.5 million Oregonians, more than half of the population, live in what are called health professional shortage areas. Most of those healthcare deserts are in rural Oregon.
So we see that every day just in the access and the challenge that our community has just in getting access to care.
David Cobble is the CEO of Sky Lakes Medical Center in Klamath Falls, which is already a teaching hospital connected to OHSU and Oregon Tech.
So students are already coming to us and receiving medical education, hands-on clinical experience. So our partnership in this is we are literally across the street from one another.
Cobble is excited about the prospect of doing more because right now Oregon brings in more doctors than it creates.
So this is trying to say, how do we begin to change that? And so we're not importing people from outside of Oregon to practice medicine in Oregon, but we're actually growing our own.
It's the early stages of developing a second Oregon public medical school and the first to center on osteopathic medicine at a time when most would ask not why, but why not?
I think everyone understands the need. I think everyone has had issues getting appointments with primary care physicians, and I think we've all felt the strain of that.
Tim Gordon, KGW News.